Hey guys, Nick Mahavich here, Active Physical Therapy. Those of you who know me may have heard the story of how I hurt my back. I ruptured a disc in my L5-S1, ended up having to have surgery on it. So I do deal with those aches and pains that some of my patients come through. So when they come through and say it hurts in my back, hurts down my leg, I understand what they've been through. So what I do, I just had a recent flare up, I think from running, and I forgot about doing some of my exercises. But what I want to do is I want to show you today a couple of the exercises that help get rid of that achiness and pain that I was having in my hip and down my leg a little bit after that recent aggravation. So if you've been diagnosed with a bulging disc or herniated disc, if this is you have pain with sitting too long, if you have pain bending over, if it feels better if you walk around, if your pain improves, if you feel like when you lean back when you're standing up, these are a couple exercises you can do to help get rid of that pain hopefully and help get pressure off that disc. So disc problems usually usually respond well to extension. So all you have to do is do what I'm doing right now. I'm laying on a mat. You can do this on the floor, you can do this in your bed, and I just got my elbows propped up underneath my shoulders, and I'm just gonna hang out here for a few minutes. What that does is it opens up the disc space, takes pressure off the disc, and if you do have a disc irritation, bulging disc, herniation, this is gonna hopefully help get that disc back where it needs to be. So things you wanna look for is, obviously if it's making your pain worse, you need to stop immediately. We don't want any worse pain. If your pain is getting worse down your leg, you need to stop immediately. Contact your doctor or your physical therapist and make sure that they know what's going on. If this helps, if this is making your pain better, or feels like it's pulling the pain out of your leg, you may feel it more in your buttock or low back, this is a good sign. We want to centralize the pain. So if you have pain all the way down your leg, up into your back, if we make it a smaller area, this is good. It's called centralization of pain, centralization of your symptoms, and this is what we want to do. Okay, this is a good sign. So if you respond well to this one, and this feels good, and you feel like I've got a little bit of relief, or even if it says like it hasn't changed your symptoms, it definitely hasn't made it worse, this is something that disc problems still respond to. You just may have to do it a little bit longer. So you can usually hold this for 3 to 5 minutes. I'll do this while I'm watching TV or working on the computer. And then what I'll do after this is, we call it a press up. So you're gonna get like you're getting ready to do a push up, and then you're just gonna arch and then back down. Just comfortable range of motion. What I would do is about 10 of those. Nice and easy. Again, don't increase your pain, don't increase your leg pain. If it feels like the pain is getting better or coming up your leg and the leg pain is not as bad, these are things that you should continue to do. And you can do these throughout the day, even up to 3-4 times a day if you're really in a lot of pain. So if you think you have a disc problem, if you are responding to any extension where you're kind of lean back or you get out of a seated position and feel like it's better that way, try these 2 exercises and see if it helps. Let me know if you have any questions or concerns. We'll talk to you guys soon.